Hi, and welcome to All the Woo A to Z. We're your hosts, Suzanne
and Mychal, and this is Season 2.
Welcome to All the Woo, Season 2, Episode 1, Letter Q for Quantum Healing.
And what is quantum healing? That's the question.
That's the question. What is? And the subsequent question is, how have we not talked about this before?
That's true.
Given our own personal histories. So I'm Suzanne, and I am going to be spending this next week focusing on figuring out the astrology because it's all happening on my head.
True.
And you, Mychal?
And I'm Mychal, and I am going to be probably doing just a lot of sleeping, and hopefully, recovering from surgery and hopefully having obtained some intel, some underground intel.
From the other side.
From the other side for everybody.
The other side, but.
Correct. From the unseen side. So welcome to our non-judgmental table, where we are just sharing our own personal experiences and understandings with these topics and hoping that you, at the very least, are entertained.
And when it comes to the quantum medicine, we have lots and lots of stories.
That's true. Probably more than what this episode will be able to contain.
So what are we drinking to go with quantum medicine?
So what we are drinking is a wine called Botanica, made by Antica, Terra. It is an Oregon wine, and it's a Pinot Noir as well. It's also organic. What's interesting about what Antica Terra does differently is that instead of taking wine from one particular plot of land and having it be like, okay, this plot of land is creating this wine and this one's creating this wine, the winemaker instead has different plots of land that they're pulling from, and instead kind of tasting them individually, kind of getting the general profile and personality of whatever that pull
grape is for that season.
Not even more specific to that. So she'll taste like just different plots of pickings and see what the personality is of that plot of picking, and then blend it with other similar styles.
Kind of like making a bouquet of only purple flowers.
Correct.
But from all different kinds of parts of the world.
Exactly.
Okay.
Except for this is still all coming from Oregon, and it's still all Pinot Noir. But yes, it's more that idea, which is very different than what a lot of other winemakers do. So thank you. That actually helps that a lot. Yes. So this would be like the purple bouquet idea of Pinot Noir. And this particular personality of this bouquet is a little bit more
pink.
It's luscious. It is a little bit richer, also a little bit more fruit forward. And on the label, it actually has Botanica plants actually on the label of it. So things are done a little bit differently in a more organic and kind of holistic kind of way of compiling things together, which is appropriate for our subject.
There you go.
Yes.
Matching it perfectly.
Yay.
Once more.
Thanks. All right. Quantum healing.
What's
is
it
this?
Good for?
What is this? What's it good for? What is this all about?
So I will start with my experiences of quantum healing.
Mm-hmm.
And first of all, that's an umbrella term for basically anything that your insurance won't actually pay for.
That's true. None of the things that I've ever gotten done under that umbrella I'm just purely out of pocket. 100%.
I think there are some places where acupuncture will now be reimbursed and is being recognized.
True. Chiropractics
too. Mm-hmm. But pretty much every other thing is considered just to woo.
Yeah. Yeah.
And so that would be any kind of vibrational healing, sound healing, anything where it has a noun and then healing after it.
Yes.
Is pretty much going to be considered.
Yeah. Reiki, anything like that. Yes.
Anything where you're not working exclusively with the body.
Correct.
So, mental healing that is not therapy.
Yeah.
Any kind of past life regression stuff, any kind of real believing that you are more than just here and now.
Yeah, that you're more than just physical cells. It's kind of looking at healing from the idea that you're more than just the body, that you're also a spiritual body, you're an emotional body, your vibrational body, that there's mental elements that affect. So that these components can all be a part of the healing and be affecting other parts of your physical as well, right? And that in order to address the problem, you need to address all of those different bodies.
And so, an example that I have used a lot, it seems recently, is I have a book on the secret life of teeth.
Yes, which we have used recently.
And so, from Chinese medicine, we know
Mhm.
that there are meridians that run through the body, and a lot of them run through the mouth. And the idea being that each tooth is connected to a specific part of your body
Yes.
and is connected. And so, one of the reasons why it's so important to have regular dental care is
Mhm.
because you can oftentimes see where big problems are happening in your body before they actually happen, because they're happening in your mouth first.
Yes.
And that's why heart doctors in particular are like, what did your dentist say?
Mhm.
Because the correlation is really tight there. But in this book, Secret Lives of Teeth, it also connects like to the emotional stories that we carry. And so each tooth is seen as an archetypal tooth.
Right.
And so it has like those emotional signatures on it.
Mhm.
And so, as we have, experimented with,
Yes.
when those things are happening emotionally, those teeth get angry.
So we're not going to go into all the specifics here, but I'm going to tell you a personal Michael story that's recently kind of come up.
No ghosts.
No ghost, but this one has to do with teeth and my surgery together. So for those of you who have not had surgery before, and this being my first like real surgery, I had dental surgery done before, but that's not really quite the same. You have to go through all these checkups. You have to go to a regular doctor. People you need to go EKGs and do all that thing. Make sure that you are fit to go under. Essentially, right? That you're healthy. You need to have no other infections that are going on in your body. That's what they're looking at. And so, yeah, you have to stop medications and supplements and all that kind of thing beforehand. So I was doing my due diligence, making sure that I'm doing everything. It's like a week before my surgery, and I have a filling pop out. And I started to freak out. I'm like, what am I going to do? Suzanne was witness to this. I think she's kind of trying to calm me down a little bit. It's a little on the freak out, but it was true because I am that annoying person that looks up on the internet, like, what are you supposed to do? What is I learned too much about
She
something.
does it real super right.
I'm very
Doctors are
thorough.
surprised at how much.
Yeah, I'm sure I'm not their favorite patient for that reason. That I'm like, I know that it says, and they're like, uh huh. They give you that look like, okay, like, yeah, that was me. And it actually does say that for dental
Mhm.
things that you do need to be in contact with your surgeon beforehand
Mhm.
to let them know. And so that was something that I had to navigate. Turns out I needed a crown. So of course Suzanne was looking up. She's like, have you looked up the tooth and what the emotional reaction, like what the correlation is? I'm like, no. But point being is that it's not unusual for you to have a physical ailment and then also have a tooth situation or have
Mhm.
a teeth issue at the
Mhm.
same time or around the same time. That they, like all things, as we've talked about in many different ways, nothing is a silo.
Yeah, it's that is the point of holistic medicine,
Yes.
which is in fact what quantum medicine is.
Mhm.
With quantum being the, tiniest little change that affects everything,
Yes.
and holistic being the whole person that you are. And that includes your, all of the different bodies that you have that surround your body.
Yeah.
So your astral body and your spiritual body and all of those things. And there are some forms of quantum medicine that I have practiced
Mhm.
that are actually dealing with those bodies.
Yes.
And so, you know, 2 feet away from your body, you are still within your energy body.
Mhm.
And so if you can repair something that is out of tune, literally out of tune,
Mhm.
2 feet away from you, that you will feel better in your physical body.
Yes.
Just like if you
So,
can heal a broken heart,
yeah.
you can heal a broken heart.
Yeah. I sometimes working on a frequency. Okay. So it has been described to me in therapy, right?
Hmm.
There's a kind of therapy that you can do working from the outside in, where it's if you're feeling depressed, as an example, you can smile
Hmm.
in
And it
order to try.
activates different muscles and actually
Yes.
sends the right chemistry to your head.
Correct. Right. And so therapists actually use this kind of idea And so some other doctors that work in this realm or healers that work in this realm are kind of doing the same thing, like frequency healing and things like
Mhm.
that operates on the same kind of idea. I think
Yeah.
of it like you just said tune, it made me think of auto tune. It's like auto tuning your body.
Yeah, and that's what you use. You actually have a tuning fork,
Hmm.
and you are tuning to the healthy part of
Yes.
you're tuning your whole body to that healthy tone.
Yes.
Because one of the fascinating things about frequency is that if you walk into a room with a bunch of out of tune things and you have something that's properly tuned,
Hmm.
everything will arrive at that tuned state just by hearing the proper tune.
Things like to be in harmony.
Exactly.
Yeah.
And so that is kind of the basis of frequency healing, I think,
Hmm.
that if you just, because your body wants to be healthy
Yeah.
and wants everything to work properly and that's why so much I think of the idea behind quantum healing is if you just remove the things that are keeping you from being healthy,
Hmm.
which is, oftentimes all of the bad things, the parasites and the overgrowths and the um help me out here, all the different things. The allergies, the sensitivities, the ways that your cells aren't working properly, the ways that your
Yes.
blood isn't flowing properly, all of those hindrances
Hmm.
that if you just remove that stuff,
Yeah.
then your body wants to be in homeostasis,
Yeah.
wants to be happy and healthy.
You give it a leg up. You make things a little bit easier for it. Something that I find kind of one of the ways that Suzanne and I, our friendship blossomed outside of our Egypt conversation, it very quickly, some other conversations came into like healing. I think I was having some other issues physically at that time. And I was like, I was getting frustrated with something. And it came down to, I was kind of joking at one point, and I still kind of joke a little bit that Suzanne is a little bit of a holistic healer concierge. She has experiences with a lot of different forms. So that's also something I think that's really important to note is that there's a lot of different levels or different types of, I'm going to just call it holistic
Hmm.
healing, right? And some are definitely way more scientific based.
Hmm.
Some are maybe more woo based, but if you had somebody from that modality, there we
Hmm.
go. That's the word I'm looking for.
Hmm.
If you had somebody from that modality explain it to you, I'm sure that they would also have a very scientific way of explaining how it
Hmm.
all works. I don't know that anybody who ever practices those things is ever like, well, you just kind of generally wave something around and,
It'll be
it'll
fine.
be fine.
Yeah.
Yeah. Yeah. I don't think that ever happens. But
No, my experience is that everybody who's involved in any kind of modality of quantum holistic
mhm.
healing is super into how it works.
Oh, yeah.
Like just absolutely fascinated because again, it's the microcosm, macrocosm idea. And so, you know, it's understanding how the universe works.
Yeah.
And that just is cool.
Yeah, no, it's very cool. It makes me think, okay, so this is, I don't know that this would be in the realm of quantum healing necessarily, but it kind of touches on it a little bit. When I was talking before about the Edgar Cayce style
Hmm.
readings, that people that I go through for that reading, they
Hmm.
also had a healing or
Hmm.
health reading that they could do. Those readings were a little bit different. You had to tell them where you were physically going to be at a particular time when they were going to be doing it because
Hmm.
they're actually scanning your physical body and all of that at the same time. But the way that the report is always structured, they always start out in the reading with what is the mental thought that is kind of the root cause,
Hmm.
cascading effect
Hmm.
of, and how that's related and causing other problems in the body.
Hmm.
So, kind of first identifying what the thinking is behind it,
Hmm.
and then what it's doing maybe emotionally, and
Hmm.
then what it's doing physically to you and how that's showing up. And then from there, it'll kind of like backtrack
Hmm.
and give you solutions on how you can address this on a lot of different levels.
Hmm.
So I think some of the more fascinating responses that I've gotten on like how to address
Hmm.
certain issues was not only through different foods that I could eat because of certain vitamins or minerals that I was lacking in my diet that I needed a little bit more of. So there was that. But then also even came to address how my brain was in like a loop
Hmm.
that it needed to break or that I needed to enhance the capability
Hmm.
was for me to read mystery novels in order to link how I was reasoning through a process. So not just jumping to conclusions, not just kind of daydreaming, but like understanding the structure and
The
like
step by step.
step by step of how everything works. That in reading it, I'm training my brain to go through that process regularly.
As a person who wrote mystery novels,
Yes.
I can testify it is definitely a process.
Yeah.
And it's the opposite. To write is the opposite of to reading.
Correct.
And I would say there was a point in my healing journey
Mhm.
where my doctor, who was an alternative, what do you call it? What's the word I'm looking for? A naturopath.
Yeah. Naturopathic doctor. Yeah. There's a lot of terms.
Yes.
Yes.
And we don't actually know what all the teeny tiny differences are. But within that range, she was like, I can't do anything more for you physically.
Mm-hmm.
The problems that you have are all emotional.
Mm-hmm.
You need to do something else because your physical healing has not only hit a standstill,
Yeah.
but it is deteriorating.
Yeah.
So you need to change something in your emotional state.
Mm-hmm.
And so I began a very intense, very in-depth, revolutionary
Yeah.
approach to not just a therapy thing, but
Mm-hmm.
a rewiring
Yeah.
of my whole operational system.
Yeah.
And then that opened the door for me to be able to receive the next level of physical healing and, kind of see how those two things went together.
Yeah.
And, quite honestly, if you don't believe you can heal,
Yeah. Then it's probably not going to happen.
you can't.
Yeah.
Because I think in most cases, we would rather be right
Mm-hmm.
than be healthy or happy.
Sometimes. Yeah.
And so if the rule is, I will never be healthy.
Well, then there you go.
Yeah.
You're living out your dream
Yeah.
right there. Yeah.
Yeah, exactly. And so I think one of the lessons I learned on my quantum healing journey was not only to believe that this was a phase that you were going to go through and come out on the other end,
Mm-hmm.
but to have a plan for how you were going to be healthy.
Yes.
Because, I find it fascinating and think about this often. When Jesus healed people,
Mm-hmm.
he always said, do you want to be healed?
It's a good question.
And I think it's a good question because, you're talking to somebody who, like the guy at the pool at Siloam, who had been there for, I think they said 20 or 30 years,
Mm-hmm.
trying to get into the pool. And his entire lifestyle, his identity, his relationships, like his entire universe was based on that.
Mm-hmm.
And to become healed meant he was going to lose, a place to live.
Yeah. His whole identity.
Yeah.
Yeah.
And how he got his meal. I mean, like everything.
Yeah.
And so, the courtesy question of, is this something you really want? But not just, I don't want to be in pain anymore, but I want to be a healthy person.
Yeah. Are you going to be able to change totally? Like, are you willing to change totally? Because that's actually really what it means.
Yeah,
honestly.
because once you get to, okay, your scans are clear, you're whatever,
Mm-hmm.
then how do you build the lifestyle
How do you support that?
that makes it an escalator that you're going up on?
Yeah.
Yeah.
I find it interesting. I mean, so there are definitely, I know doctors that work in this
Mhm.
way, and they are in touch with all these different kinds of modalities of healing that they incorporate in what it is that they do in order to support the very physical thing that they're typically working with you, requesting that you do, all that kind of thing. You can do it without those doctors. Like, you can definitely you can piecemeal it if you want to do that. That's kind of what I'm probably going to do with my surgery. I'll tell you that. Like, after I get the surgery taken care of and I take care of all those things, and I'm still going to do all that's required, the physical therapy and all that on the back end.
Virgo.
I'm very specific about making sure that I follow all the steps. Yes. But I'm also probably going to follow up with my intuitive healer that I go with as well to help with the healing process, because chances are there's something else underlying on this that also needs to be addressed. I need to make sure that I'm also cleaning that up too.
Yeah.
Right. Just as like an example.
Yeah. And that goes back to the teeth.
Yeah.
Like, sometimes the teeth are the Post-it note that our body sends us of like, dude, you need
Hey.
to check that. You need to, you need to look at this a little bit more closely.
Mhm.
This emotion that you think that you're, bypassing,
Mhm.
or this, you know, crushed dream or whatever
Yeah.
that you're like, oh, I'm walking past it, is like, no, no, you've buried in your gums
Mhm.
and nothing stays buried.
Yeah. You didn't get rid of that.
No,
Exactly.
you postponed it.
Mhm.
And one of the things that you and I have discussed multitudinous times
Yeah.
is you got to get it out of your body.
Mhm.
If your heart's broken, you have to scream, you have to cry. I mean, it's better to sit on the couch and watch movies and weep
That
and
make you
get
cry.
it
Yeah.
out
Mhm.
than it is to stiff upper lip and, go along and develop some horrible disease later because you buried it in your body.
Mhm.
Yeah. So,
Absolutely.
so feel your feels
Feel all the feels.
and
So
purge them.
yes. Okay. So Suzanne, as
Yes.
being a connoisseur of holistic healing practices, if somebody is brand new to this kind of, I'm going to put terminology, medicine, right? This kind of medicine.
Which usually means they have reached some sort of impasse with traditional Western medicine.
Correct. Something's not working there.
Yeah.
And they were looking for something that's maybe a little bit more tangible, scientifically forward
Mm-hmm.
in its presentation,
Mm-hmm.
for lack of a better term. What kinds of healing practices would you suggest that somebody maybe take a look at?
Well, it's not that far out, but
Mhm.
thermography, and Europeans, those hospitals have used thermography for decades,
Yes.
but it's still considered kind of outside the bounds here in the States.
Mhm.
But it's a great way of scanning your body and seeing, quite honestly, where you have hot spots and cold spots.
Yeah.
And that's, showing you where you have inflammation and stagnation. And oftentimes, at least it's been my experience, it can see things before anyone else can.
Yeah. Where's the
So,
cog in the wheel?
yeah, yeah. Where did you stick that fork through your cycle?
Yeah.
So I would say that.
Mhm.
And it's not the cheapest option, but it is the most comprehensive.
Yeah, it is actually. It's very.
Um,
I've had it done.
and, years ago, I did have a dental thing that was, sort of a flag about something else.
Mhm.
And before the dental thing and before the other thing, it showed up in my thermography scan.
Yeah.
I didn't know what to do with it at the time.
Yeah. Samesies. Yeah. They go to like all of your teeth, literally all of your teeth. And they're like, yeah, we can see that you have brewing infections
Yeah.
on this tooth and this tooth and this tooth. And it'll tell you what part of the body it's actually in relation to. And then they'll also kind of show if you're showing inflammation in that area too. It gets very specific.
Very specific.
Mm-hmm.
So you not only want to have the scan, but you also want to have someone interpret it for you.
Yeah.
But I would say that is because it's still such a physical connection.
Mm-hmm.
So if you're coming from Western medicine, it still makes sense.
Yeah.
And then I would say possibly the next thing, like if this is all on a spectrum,
Mm-hmm.
after thermography,
Do you think that maybe Qigong or
I would say
acupuncture?
for something that you're learning on your own,
Mm-hmm.
I would actually say tapping,
Okay.
just because it is the acupressure points.
Mhm.
But I think as I have both observed people in my life declining
Mm-hmm.
and seen kind of how repair works, it seems like one of the things that happens is when you stop touching your body, you lose. She was not expecting that.
Sorry. My second grader mind. There we go.
I deliberately chose a very
I know.
adult phrase.
Safe wording. I know. Sorry, everybody.
But even just touching your face and being able to feel where your skin is clogged,
Mm-hmm.
touching your hands and your feet and noticing that they're cold even though you're warm, or they're warm even though you're cold. I mean, just all of those things, like we have been given, I think, in the Western world, but especially in our sort of puritanical US
Mm-hmm.
frame, no matter how you were brought up, that's still, I think, a kind of pervasive element of the culture. that we don't know what normal is.
Yeah.
And so, you know, you don't know that you have a lump because you haven't touched, the outside of your arm for
Yeah.
6 months
Yeah. So
or anything like that. So I think tapping is really good for just bringing you back into touching your body and realizing
what's going on?
and being able to feel like I
Mhm.
can feel blood, I can feel bones, I can feel muscle, I can feel that seems weird. Oh, I do this and now it feels more relaxed. Like
Mhm.
just doing those things because, I don't think we're taught. Let me rephrase that. I was not taught to in any way revere the machine.
Mhm.
And I don't even think of it as a machine anymore, but that is about as close to a metaphor as I was given.
Mhm.
And it was kind of like, you need to get your oil changed regularly and you need to, take it in for a checkup once every month, a
Yeah.
year, and all that kind of stuff. And so the concept of I will do this thing and then it will be done.
Yeah.
That machine mentality, I think, is a real downfall, both from the joy of being in a body,
Mhm.
but from the other aspect of you think, well, I took it in for an oil change, and so it's good
Yeah.
between now and the next oil change, as opposed to, no, it is a living, breathing thing. Like you
Yes.
would not treat your plant this way.
Mhm.
So just pretend you're a plant.
Yeah.
Sing to yourself, pet your leaves, make sure you get enough water, like all of those
All the
things.
things. So, speaking of the spectrum, on the other side of the spectrum, what would you put, like, maybe on being, like
The farthest to reach,
correct?
I would say it probably is distance healing,
Mhm.
which for reasons I can't explain other than my grasp of reality has always been a little bit different.
Mhm.
That was one of the easiest things for me to do.
Distance healing?
Yeah, it's
Mhm.
kind of like, yeah, I believe that you can just see me in your mind and you see me as an energetic body and you can just tweak and, massage whatever is there in my energy body that you can see however many 100 miles away.
Right.
And yeah, of course.
Yeah.
But then, that's effectively prayer, which I also believe in.
Yeah.
And I think it's Lynn Taggart has done some amazing books that scientifically demonstrate the power of prayer.
Yeah.
But yeah, I would say that's probably, if you're a very concrete person and have come from a Western medicine background,
Hard to wrap your mind around it.
that's the one that it's like, wait a minute, I'm paying somebody to be on the phone with me to tell me, oh, your left thigh is a little bit swollen. Does it feel swollen? And you're like,
Yeah.
I came to you
I
because I had a
guess.
stomach ache,
Yeah.
not realizing that, it's all connected.
But to let all of you out there know, have known people, and I myself have experienced it, where I've those kinds of healings.
Oh, absolutely.
Sometimes they call things out, and you're like, "How did you know that?" Like, it can be really profound if you're
Hmm.
in the right mental space to accept something like that and to work with something like that. It can open up a lot of
And I
doors.
think that is a key right there, back to the Jesus example of, do you want to be healed? If somebody has this insight for you, are
Mhm.
you willing to accept it? And maybe that is the biggest difference between quantum holistic healing and Western medicine is in Western medicine, we're very much trained. You walk in, the doctor knows everything. The doctor tells you exactly what to do. The doctor doesn't actually want to hear what you have to say.
Yeah.
And you go out and you've had your oil change and you're good.
Mhm.
As opposed to Eastern medicine, holistic, what
Yeah.
all of the
All the
slashes,
terms. Yeah.
is you are taking responsibility
Mhm.
for your health and your participation. And it is a flowing sort of relationship between you and whoever the healer is and your body,
Mhm.
and that there is no arrival.
Yeah. Okay, so we could probably talk about this for forever, and maybe we've made it more confusing for you, but hopefully we made it in a little bit more we've
Accessible.
accessible. Yeah, of like what is that? What do people mean? But there are way more modalities than what we even mentioned and all of that out there. So,
I will put some of my favorite ones in the notes.
yes.
Um,
Okay, so next episode. I chose the letter last time, so you get to choose this time, Suzanne.
so I feel like Michael went in and found the most difficult letter, so I'm trying not to even touch.
I know. I don't know how I did that. What is that?
It's an R.
R. Okay. All right. So I guess join us next time on all the woo for R. A to Z.
A to Z.